Tongo etana butu einda Kembo na zambe etondi mokili Hey Yahweh kumama
Tens of thousands and perhaps hundreds of thousands of people are dying of fungal infections in sub-Saharan Africa.
Like tuberculosis, fungal infections are a very serious cause of morbidity and mortality in immunocompromised patients like patients with HIV.
The mortality rates for this organism, Cryptococcus, this sugar-coated killer, continues to be extraordinarily high. It's in this country, in sub-Saharan Africa.
We see about 150 to 250 patients coming in a year with cryptococcal meningitis. And unfortunately, almost between 20 and 40% of those patients die while they're still in hospital.
We still have 15 to 30% of our patients dying of this particular infection. We're not going to have more drugs, so we need to be better at our strategies.
In the African setting, many people go to the hospital when they're really hopeless, when they're like almost losing hope.
Education is not so well disseminated, especially in the rural areas.
People still go some long distances to get care, which is a big factor on losing people to follow-up. And so you would want to have centers which are closer and closer to the people.
We do not have a great deal of funding in medical mycology, and that's partly due to the fact that we don't have enough individuals who are interested in this area.
There are still issues about access to some of these drugs. Flucytosine, which is a component of what we think is the most effective combination, is not available in Africa.
Growing in Rwanda is difficult when you compare to other parts of the world. Sometimes it was difficult, and to go to school, you don't have school fees, or sometimes you don't have food.
We've still got relatively limited number of drugs, and I think we really need as a community to push for development of new drugs, more tolerable drugs, and drugs with more potency.
Prevention, access to diagnosis, access to treatment, and improving the treatment will be needed to really overcome this problem.
I'm the only one in the family that's a pure scientist.
My future career, my future goal is actually to become the first formally trained mycologist in Uganda.
And my sister is going to university and she's hoping to become a medical doctor or a scientist in the future.
Well, right now, with the different fundings and the different researches that are going on, well, there's hope for these patients.